will envision a time children 0 to 8 have access to quality, affordable early childhood care, education and development, and most importantly, that girls and women carers have a supportive working environment. And that's why it's really important to be here, because we are talking to allies. We think our model is uniquely designed to achieve the best possible outcomes for children, because as long as the carers are able to run effective businesses, as long as the women the female workforce is trained and certified, then children can be assured of quality care. Now, what have we learned over the last 3 years? We've learned a lot. On policy and regulatory reform, the government is more than willing to legal reform. We work with the county governments, about 5 county governments, Nairobi, Kisumu, Mombasa, Sia, and Kajiado, and they are all willing to engage. Most importantly, the national government is also willing to engage, and I think this is a really important space for any actors willing to join, to really rally with us through the collaborative action for childcare to enable change to happen for children. Non-state actors are rallying to support government action. Example of how we can hold government to account, not by advocating, but by working with government to make policy happen. Recently, we formed a national policy and technical working group for the early childhood education and development sector. And in March, we'll be having a conference that for the first time looks at the policy issues affecting this particular group. And obviously, carers and childcare micro-entrepreneurs will be at the center of that conversation. On accelerating women-led childcare enterprises, I think we've learned that the problems are much more deeper than we thought before. We realize that solutions that exist at the moment are only touching the tip of the iceberg, and therefore there is an opportunity for all of us working in the women's economic empowerment sector to actually rally together to design solutions that will benefit this growing network of women childcare entrepreneurs. We're increasing their visibility, working with government to ensure that registration is easier, and therefore creating conditions necessary for them to thrive. As I said, under workforce development, I think we are learning there seems to be, perhaps I stand to be corrected, but there seems to be little intention within the sector or interest to actually transform the training and certification of the childcare workforce. Everybody seems to be doing things on their own, and we are talking to government. They are willing to work on a national curriculum, but it's really difficult to get actors around this particular issue. And again, it's very important to say that to really give the care or rather trust an untrained workforce to take care of Africa's children offers little comfort for our future, because we know that the first 1,000 days are really important for children. And if an untrained workforce is what the country depends on to really take care of its children, then we are in trouble. And most importantly, I do not think it gives any mother in the room or in this country comfort to leave their children under people who are not trained. On collaboration and learning, there is a shocking level of fragmentation in the sector. Everybody wants to do their own thing. And even as the collaborative action for childcare, even as we try to really say we are a market facilitator, we are not competing with anyone, it is still a really difficult task to get people working together. But we believe that collaboration, as has been said this morning, is not an option. We must work together, and particularly within the early childhood care and education ecosystem, there is absolutely no time to waste, because children are growing up every day. They need quality care. Women are really marginalized to an astounding degree, and we must center even the conversations around unpaid care actually on childcare, because I was personally shocked a couple of years ago when we were beginning to set the foundation for setting up Uta Beauty Africa, I talked to prominent feminist organizations and researchers in Nairobi, and I asked them, what do you think about childcare? Is there an issue that we could address? And they told me, we do not work in childcare, but we work in unpaid care. We focus on unpaid care. And as a man trying to make a difference within the sector, I had no word. But then I think the situation is changing, and there are many of us, and I didn't know it was there, but as that framework is showing, it's an expanding network of organizations, government, and individuals, institutions that are really committed to accelerating quality, affordable early childhood care in Kenya. And our hope is that this model can be replicated in other countries when we have actually documented it and seen the difference it's making for our children and the women taking care of them either as workers or as micro-entrepreneurs. Thank you.
Thank you so much. Well put. This is something that you can't do alone. This is something that Oxfam or any other person can't do alone. We need to pull our resources together. And the significant contribution of this to, unpaid care and domestic work is that if we have many more of these centers, is that women have a safe place to take their children, and then now engage their time in other economically productive activities. It doesn't have to be that if a woman gives birth, they have to stay at home with their child for 5 years before they can, take on other tasks, because they have to take care of the child, and that's their, their primary mandate. So with that, I'm told Ms. Carol Gatwiri from KNBS has joined. Carol, if you can hear me, you've seen how women are spending so much time on unpaid care in domestic work. I think one of the studies that we did in the informal settlements, what came out is that they were spending about 11.1 hours of their day on unpaid care in domestic work. So my question to you is, as a government institution that is mandated, with just gathering statistics and using those statistics to inform policies and decisions, is this a concern to the government? And if yes, what is the Kenya National Bureau of Statistics doing about it?
Thank you very much. My name, as you heard, is Caroline Gatwiri Muturi from Kenya National Bureau of Statistics. And I want to pass my apologies as well from my colleague, Mr. Wambua, who was supposed to be with us today, but he could not make it due to some official duties. But gratefully, I'm here with you. So, so a quick one in terms of unpaid care and of course domestic work. So the Bureau is also concerned, and what we are doing currently on that note, we're in the process of collecting time use statistics through a time use survey that is essentially supposed to quantitatively measure how much time is spent on this domestic and care work in other activities as well. So thankful to the UN Women and through the Women Con program, as well as other stakeholders, also Oxfam, as the Department for Gender, Groups, SDGs Kenya Forum, to mention but a few, who together we are in this process of collecting data for time use. So time use survey, as I mentioned again, is supposed to assist us in knowing how much time that individuals allocate on different activities during the day, to provide a detailed pictures of people's daily lives. So for this time use survey, the objectives are essentially to just identify the gender differences on time use pattern. Another objective is also to assist in informing policies as well as resource allocation to programs that are just geared towards gender equality as well as women empowerment. And most importantly, remember, as a country, we've also we have our commitments, either internationally, regionally, or nationally. And in terms of time use, specifically, this speaks to indicator 5.4.1, that is supposed to measure the proportion of time spent on unpaid domestic and care work by sex, age, and location. And then additionally, trying to really make the invisible work visible. So time use will assist in improving on the compilation of the contribution of household production to national accounts, which in essence is supposed to enhance coverage on national income and product accounts, which provides measures to economic activity of a nation. What happens in this case? So a majority of activities or goods and services that a household produces for its own private consumption are not taken into consideration for the national accounts. So, how we are doing this or how we are implementing this is through a module on an ongoing survey that is called Kenya Continuous and Household Survey. It's not a standalone survey, but it is a module on that specific survey with a target sample size of 24,000 households, and using what we call a retrospective diary, where an RA visits the households that are sampled, and they are able to fill in the questionnaire on the diary on how they spend their time for the last 24 hours with an interval period of 1 hour. So for each and every 1 hour, referencing the previous days, the list of activities is filled in with a maximum of 3 activities. And then how these activities are classified. We are using the International Classification of Activities for Time Use Statistics, 2016, shortly referred to as ICATAS 2016, which is supposed to assist us in ensuring that these activities are grouped well in a very meaningful manner. And it's internationally accepted, so we can be able to do a comparative analysis for different countries on how we are faring as a country. For the specific unpaid caregiving and unpaid work, these are measured through the ICATAS 2016, which has the activities grouped into 9 major divisions. For major division 3, that is where we have the unpaid volunteer work list of activities. For major division 4, that is where you have unpaid care work on that division, where activities are listed on that. Who are we targeting? We target respondents who are aged 15 years and above, definitely randomly selected, and the respondents are 2 per household. So that's just a quick summary of the methodology on how we are collecting this data. So, and what are we collecting, or what are some of the key indicators that you're collecting on using the questionnaire for the time use survey? Definitely day of the week, because different days of the week, individuals spend their time differently. They also allocate their time differently, also based on the month. That is why the period for the collection of data is taking the entire year from the Q1 of 2021 to the last quarter of 2021 as well. So that's to enable us capture all the seasonalities and on how people essentially just spend their time. And then also using the ICATAS 2016 classification to be able to code these activities, where the respondent basically just describes how the activity or what exactly they were doing in these activities. And the duration is recorded in minutes, of course, because these are hourly interval. And then we have what we call the contextual variables. So the contextual variables are supposed to really give us more in-depth of what the specific activities are. And in this case is, we have 4 of them. Whom did you do this activity for? Was it for yourself or for someone else, etc.? And whether either this work was either paid, was it for profit or not? And again, who was with you while you're doing this activity, as well as the location. We all know these different elements really they have an influence on these specific activities that you do. And then we're also measuring the essence of whether they were enjoying this or not. So, and also some questions on gender equality or the perception towards gender equality as an additional element to really measure for this time use survey. So a quick one on what policy implications to enhance the visibility, or also to enhance the use of this data, the uptake and use of this data. So time use statistics can be used to really influence policies in terms of the unpaid care and domestic work. This is an ongoing activity or ongoing activity through the State Department for Gender. They are currently working out on coming up with a policy in regards to the unpaid care and domestic work. As I mentioned earlier, again, in terms of the national economics of accounts, so we are hopefully that the time use data is going to be used to argument the national economic accounts with a goal to essentially ensure that the national income and product accounts are going to comprehensively tabulate all economic activities in a nation, not really leaving behind these goods and services that are done, that a household usually just produces for its own private consumption, or the household production that is not traded in the formal market, but it is consumed by others, to also include what is usually excluded when they're doing their measures of economic activity for the nation. Another aspect or a policy action from the time use statistics is in terms of child and family care. Not forgetting that a lot of individuals, especially the women, but you also, after the analysis, we'll see exactly who spends what and on what, who really take a lot of their time doing the unpaid care and domestic work. In essence, these individuals substitute their own time caring for relatives, caring for the sick, caring for the people with severe disabilities. And this time they'd rather be engaging in other productive paid activities, but they usually do a lot of unpaid care work, and they do less of the paid productive activity. So that's also another area that hopefully that the data will be able to inform. Key again in that is the social welfare issue, more so the social protection elements to be able to cushion the vulnerable individuals in terms of giving them some money, basically through the social protection scheme, on how they can be able to substitute the time they're spending on these other issues, the unpaid care and domestic work. And also lastly, data could also be used to really inform labor and employment related policies. When you look at issues for the paternity leave, maternity leave, you know, overworking, overtime, etc. Once we look at how the data basically tells us on how individuals are spending their time. So time use is not only collecting data on unpaid care and domestic, but other activities as well. Like Major Division 1 is collecting data on employment and other related activities. So we can be able to do a comparison and look at all this dimension. So status, I said we are in the process of collecting the data. So we are in the process of collecting data for Q4. So currently, if we do analysis of the data, we cannot have it at the county level. It can only be available at the national level. But once we are done with the entire data set, from next year, we are going to be able to have data county level and below, but we shall see how this works for us. And also we did a pilot July 2020, again also in October 2020, that informed the decision to amend a few of the issues that are not really coming out clearly well. So I think I am done with my short highlights. So I welcome any questions probably at the end of this. So thank you so much.
Thank you so much, Carol. So I guess this is, I mean, it is good news that finally the government is starting to recognize the value of unpaid care in domestic work. It should have happened like so many years ago, but we are here now. So when you see them, you know, in your house wanting to talk to you about how you spend your 24 hours, please give them your time and listen to them. But Carol, what would this mean to a woman, if you're still online, to a woman, a common mwananchi, when finally this is concluded? How does it translate in terms of, you know, reducing, or in terms of unpaid care and domestic work, or redistribution? How does this look like practically?
All right, so practically, this would definitely inform on how much women or men are spending on this, specifically the unpaid care work. And this would inform in the policies as I have mentioned earlier. And one of the key concerns for us would be specifically on unpaid care work. What can that be done? Could we have suggestions like, for example, having free childcare services so that women or men can actually be able to have that offloaded from them, have the children being taken care of with no expense at all, so that they can be able to engage themselves in other productive activity. When social protection funds are increased to these women and men as well, so that gives them a leverage to be able to have an extra income and also have someone to really take care of what they cannot do financially and give them time to do other things. Yeah.
Thank you so much for that. And this then brings me to Ted Josiah. If we have him online, Ted Josiah is an entrepreneur, a media influencer, but is also known famously as the Man Mom. Ted, you're one of the few men who has decided to go against the grain, especially in the, in the Kenyan context where people expect that if children, if one of the parents dies or is not present, then somebody should be, the children should be given to, a female relative, or these roles should be handed over to a female relative. And I know you have people who, or citizens or your followers who are very supportive of this decision that you made, but you also have, an equal share of critics who think this decision was not the right one. What do you have to say about this specific decision that you made? Why was it so important for you to bring your daughter JJ and take that active role in bringing her up? And what would you have to say to your critics specifically?
To anybody who would be criticizing a parent for raising a child, they will have to think about that sentence: a parent raising a child. All I am is a parent raising a child. My gender does not matter. And if my gender matters, then we still have a long way to go as a nation, because I do not see gender roles. What I see is parental roles. And when I decided to intentionally have a child, I made a decision that I was going to walk a journey with a child, irregardless of whether the other parent was there or not. So when people start to look at gender roles in parental situations, I get slightly concerned. And when I say people, I say this with all due respect to women as well, because some women find it awkward that a man would be raising a girl. I didn't choose to be a man, as she didn't choose to be a girl. We're just two individuals who were brought together by whatever cosmic forces were. And we had to figure out each other's journeys when her mother passed. We didn't choose for her mother to pass as well. The option has been traditionally that a man would give up all his children with that woman to her relatives or another female relative and start again, which in my mind was just absolutely so wrong, because from the moment that I decided to have that child, the journey had to be that we were going to figure things out. And the day that her mother passed, I remember sitting in the car and looking at this 3-month-old infant and saying, we will figure this out. She's now 4 years old. Thankfully, she's growing well. I challenge myself in being the best parent I can, and I don't think I'm the best parent I can. I'm learning on the job, literally. But I had very little female intervention. I had to figure out how to clean a girl's girly parts. I had to figure out how to feed a child who had never had formula in her life or water or any other object apart from her mother's milk. I had to figure out how to take her for pediatric appointments. I had to figure out how to wake up in the middle of the night and feed the child, change the child, and live that life. And I decided that I'm going to do it come hell, come high water, because this was the plan from the beginning. For me to give up on JJ would be for me to give up on her mother's one desire, to raise a lovely little human.
Thanks for that. Just a follow-up question on the same. So in this age where, you know, the era of social media, what are your thoughts on how, you know, the private citizens especially can help, you know, change this very retrogressive narrative that childcare is something that can only be done by women?
The conversation has to be had with men a lot more broadly. I remember back in 2017 when I actually started the journey online, and I was very intentional online. I said, a lot of people actually told me it is wrong for you to post pictures of your child. Some people in certain faiths said you have to put makeup on your child so that evil spirits don't interfere. And actually, at some point, I actually went offline because the negative posts, comments I was getting were just way too much. And then I sat down and thought to myself, the Bible says, greater is he that is in me than he that is in the world. And I have not chosen this journey. This journey has chosen me for a very specific purpose. And the purpose was to show young people that a man can raise a child, irregardless of their sex, gender, age, whatever. Now, I was in my late 40s at that point. The child is 3 months old. I'm suffering from, you know, fatigue and exhaustion and work and everything. But when I fast forward to now, we only had 3,000 followers in 2017. Now we have over 300,000 followers. We also had not seen a lot of men getting involved with their children. And now when you go onto social media, you're seeing that we had an impact because a lot of men are now embracing parenthood, not fatherhood, but parenthood. I think fatherhood is very different from parenthood. And that impact alone for me is a very positive impact. We see celebrities now in investing more time with their children. We see normal people investing more time with their children. That is so hypercritical for us. And for me, just as a human, I'm glad that I made that choice to go out there and show the world that an African male can raise a child on his own, because prior to this, we had seen white European males raising children on their own, fighting for custody of their children, but we had not seen Black men actually go out and just walk the journey alone by themselves 100%. Now, that is not to say now that I don't have support. I do have support now. I've got people who surround me, who enable me to be able to work, live, play, raise the child. And that's very, very critical. But the narrative that we really, really need to focus on right now is changing the mindset of men. It is not that women do not need the help. It is not that the home does not need the help. It is that traditionally we have been brought up to think that all we are providers. So as long as I go out, earn some money, whichever way I earn the money, and bring the bacon home, quote unquote, then I have provided. The rest is up to the woman to sort out. So taking the child to the pediatrician, taking the child to school, taking the child for PTAs, taking the child for sports days, there's a lot of things that, are being done by the women because the men assume that all they have to do is, quote unquote, bring the bacon home. No, get more involved, get in there. Let also your partner have her dreams, goals, and ambitions, because her dreams, goals, and ambitions may be much bigger than just raising children and having a family. Maybe she wanted to be a hairdresser, or to pursue her PhD, or to, have this aeronautical dream, or whatever it is. You have to support your person's dreams, goals, and ambitions as much as possible, because those dreams, goals, and ambitions will really trickle down. Your daughter will see that you supported her mother, and she will look for a partner who will support her dreams. And in supporting them, it's not just by words, I support you, but it's actually by actions of really getting involved, raising the children, doing the homework with the child, spending time with the child, cooking for the child. For me, it's wildly important. And I know till this present day, Jay prefers my spaghetti over anybody else's spaghetti. She prefers my cooking over anybody else's cooking, because that's the cooking that she tasted first when she started eating solid food, not because I'm a very good chef. And also, I think she's just trying to make me feel good, you know? So it's very important to have bonding sessions with your children as a dad, as a man. But it's also very important that you spend more time doing work around the house.
Thank you so much for those honest conversations. Please stay on the line. We'll come back to you. And talking of support, Purity Jabor, we heard how the CHVs are struggling at the grassroots level to try and ensure that people are accessing health services. Something that really takes so much time for women who have children. And it's unheard of most of the time that you would hear a man say, I'm calling in, or, I'm asking for a day off today because I need to take my child to the clinic, like, Ted does. Most of the time, it has to be the woman's responsibility. When the child falls sick at night, someone has to tend to this child, Sometimes you can't handle these things and you need to reach out to other people to provide you with services. And this is why we have, the CHVs who are the backbone, of community healthcare in Kenya. This is a structure that is instituted by the government. So they do not get much recognition, unfortunately. They are not valued as they should be because of the work that they are doing. So can you please just tell us, Purity, of the work that Youth Alive Kenya has been doing this year to change that and how we can help, as a society here?
Thank you so much. I think our work here around unpaid care, we've taken a specific direction, and we want to make the work of community health volunteers to be more valued and appreciated. Because I think in Nairobi County, we have an active act called Nairobi City County Health Services Act 2019 that has a component of the CHVs, and it has given a well-detailed criteria selection and also the facilitation. But I think the key problem we have, it's in terms of implementation of that act, not just implementation, and also just it being operationalized in the right context. So our work with community health volunteers, we have created awareness that it is not just community health volunteers, but we also want to change the name, because when you say volunteers, it means that wamejitolea. But when you say community health workers, there's that recognition of the service that they are providing. I think we've held a dialogue sessions with them, and this came out through our couple sessions, because we believe if you want to change narrative, and also if you want to influence policy, you have to begin from a specific direction. And for Youth Alive Kenya, we chose the grassroots direction. And we considered, and we also recognize the work and the influence that the community health volunteers play in our community. If you want something to go viral in a community, just talk to the volunteer. If you want to get into the political space, they will be the mobilizer. If you want to improve something from the grassroots, it is the community volunteers. So for us, we take them as the key actors in terms of changing how services are being provided from the grassroots. And I think one of the things we do, it is to train them. We create awareness, we build a capacity that you don't just do this work. Because for me, from my end as Youth Alive Kenya, we know that unpaid care is any other work that any other person can provide. And it is your rights and it is your responsibility to ensure and do something so that that work is recognized. So we take them through a couple of capacity building. So I think it reflects count, and they share their stories. And they thought, because now we know the way and even how to influence this act to be implemented, why not start off a petition? Looking through the CADP for the Nairobi County, there was no mention of the CHVs. It was just a normal discussion at the town hall. But due to the advocacy that, again, we've been doing, and also the submission that they made on the annual development plan, for the first time we have of community health volunteers in the physical strategic paper 2022-2023. And we are happy about it, but we're not just happy that it is mentioned. It is a quick win for the CHVs, but we want to go further. We want it to be implemented. We want to go further to ensure that our mothers are actually getting what they're supposed to get, for them to feel that they are appreciated.
How can we work with other organizations to ensure that unpaid care work is recognized, reduced, and redistributed? Just to begin by mentioning that we are a coalition of approximately 350 civil society organizations. And one of our main goal is to ensure that we build capacity among our partnerships, and also identify opportunities for advancing advocacy on different on different strands around SDG 5. So as far as unpaid care work is concerned, we work with KNBS, and I'm glad Carol was here. And we've been able to shape the work that they are doing around the time use survey. And one thing we are eagerly waiting for is the report, so that we can identify recommendations and carve an advocacy strategy to take the work they have done to the next level. In this country, the biggest, what we look at as the biggest opportunity for unpaid care work would be when the work is recognized and factored in the GDP. That would be the starting point. The quantification will help us be able to look into issues of, remuneration, the issues of, how much does it contribute, and begin to really understand from an economics perspective, how do we engage on policies on unpaid care work. There is some work that is going on at the gender department, where there's already a concept note that is being developed to put together a policy on unpaid care work. We are looking at ensuring that our members are actively participating in the development of this policy, shaping it with the findings from KNBS. The other bit is just to cascade the conversation. We are finding that the conversation is largely at a national level, and in some efforts with some partners who are making efforts to take it to the grassroots, like Roots and Oxfam, Youth Alive, but it should be taken to sort of every corner of this country.
We really need to talk about unpaid care and domestic work, because it means that some have been locked out from the paid employment because of the increased care work. And so we did a policy brief to really come up with recommendations for the government to take up and to find unpaid care work as an important subject, even as we talk about gender equality. And some of the things that, some of the recommendations that came out from the policy brief was around the things that Blandina is talking about. Recognition of unpaid care work as work. I like the fact that Caroline talked about the work that KNBS is doing around time use survey. Because if the government gets to know the amount of time that women spend and the amount of time that men spend on any other work, not just paid work. Because, like Blandina was giving us a situation, from the time that you woke up until the time that you sleep, how have you spent your time? It is very different. How I have spent my time will be very different from how someone or a woman from an informal settlement or a woman from the rural area spends their time. And so one of the recommendations was around recognition. The government needs to recognize that unpaid care is work. And in this context, then, it needs to put up public infrastructure that Irene is talking about to ease and to lessen the time that women and girls spend on unpaid care work. Our unpaid care and domestic work at Oxfam, of course, is done through partners. It's done through partners like Youth Alive. It's done through institutions of higher learning. It's done through research and evidence collecting bodies. And one thing that you must have realized that the subject around unpaid care and domestic work is not easy to talk about if you do not have evidence. And so that is one thing that Oxfam has really invested in. We've done a lot of studies around unpaid care work and why we should care about care work. And one of the things that we really try to advocate for is to even change the narrative around unpaid care and domestic work. And so we really talk about it as a social good and less as a burden. Because the moment we talk about unpaid care as a burden, then we really feel that we are perpetuating the narrative around why then women and girls should actually remain and keep on doing unpaid care work. Because all of the panelists have talked about the social norms that really define why the women and the girls are mostly doing unpaid care work. And we know that we are here because someone is actually taking care of our children. We are here because someone really ironed our clothes. And even if you did it, you took some time, right? And so for us, unpaid care or care work is what runs homes. It is the engine that runs our households. It is the engine that runs our economies. And so we've done studies. We did studies prior. So we did studies before COVID and we did studies after COVID. And so when we did studies before COVID, unpaid care and domestic work was still done by women and girls. And women and girls from informal settlements and women and girls from rural settings, of course, were disproportionately affected as compared to those who are in different classes. But COVID worsened the situation. You know, we all know that when COVID happened, then children were at home with us. Then most of the workplaces, especially the informal sector, things just went under. And what that meant, it meant that care work increased because some of the studies that we've done in Oxfam, there is a major finding around childcare. They're saying that if you have a child or if you have children under the age of 6, even some of them had to leave their paid work, their paid employment, so that they could take care of their children. Because it's a social good. Taking care of your child is a good, right? And so we did a study post-COVID or during COVID, and we realized that, especially in Kenya, now that the government had a policy around COVID management within the household, then it meant if your COVID case was not severe, if you're not having difficulties in breathing, if you're having those asymptomatic signs, then you're supposed to be managed at home. And what did that mean? It meant that your care responsibility even went up. So you're not only taking care of your children who are healthy, but you're taking care of your sick relatives. And so at this particular time, then it dawned to government, it dawned to organizations that we really need to talk about unpaid care and domestic work, because it means that some have been locked out from the paid employment because of the increased care work. And so we did a policy brief to really come up with recommendations for the government to take up and to find unpaid care work as an important subject, even as we talk about gender equality. And some of the things that, some of the recommendations that came out from the policy brief was around the things that Blandina is talking about. Recognition of unpaid care work as work. I like the fact that Caroline talked about the work that KNBS is doing around time use survey. Because if the government gets to know the amount of time that women spend and the amount of time that men spend on any other work, not just paid work. Because, like Blandina was giving us a situation, from the time that you woke up until the time that you sleep, how have you spent your time? It is very different. How I have spent my time will be very different from how someone or a woman from an informal settlement or a woman from the rural area spends their time. And so one of the recommendations was around recognition. The government needs to recognize that unpaid care is work. And in this context, then, it needs to put up public infrastructure that Irene is talking about to ease and to lessen the time that women and girls spend on unpaid care work. And so our recommendation was, why can't the government increase their budget allocation on water infrastructure? Because water is life and everyone needs water. And especially increase allocation of water and early childhood care and health in informal settlements and in rural households. The other recommendation was around redistribution of unpaid care work. We are saying that even as redistribution of work happens within the household, then the government and the private sector needs to take up its portion. Because it's just not about what happens at the house. Because we are saying if the government ensures that the ECD centers, we call them nursery schools, in Kawangware is equipped with teachers and they have meals from morning till evening, and by the time the kids are picked up at 3 p.m., the kids are safe and they have food, then it means that Mama Lillian or Ruth who is living in Korogosho will find time to engage in paid activities. The other recommendation was around hearing and having carers in leadership and in decision-making positions. Because we cannot sit as actors within NGOs and INGOs and academia and decide for the women. We do not know where the shoe pinches. We will do research, but they know where the shoe pinches.
Recording in progress.
And so one recommendation is, can we have the voices of the women in those ward committees, in those water committees, as NMS thinks about how can we bring a water tracker in Korogosho or in Madare, that Anjeri or Anatieno in Madare is actually part of that conversation. So that when they're thinking of maybe leaving the water tracker on the road, maybe 2 kilometers away, Njeri will say, no, I think you need to bring it closer. You need to bring it closer because I have a young child, and just queuing or just walking for 2 kilometers is work for me. You cannot get that narrative until you have women at the center of decision making. So those are some of the few recommendations that came up. Thank you.
Thank you so much, Ruth, for that. And before we just move to the Q&A, I think this is something that Youth Alive Kenya is seeing on the ground, that when they mobilize these women to participate in the budgeting cycles or the budgeting forums, the things that the women are requesting for is water, access to healthcare, investments in, early development and education centers so that they can get to take their children there. So this is not something that is, it's actually backed up by the stories that the women are saying. So for us to be able to achieve that element of gender responsive budgeting, we need to see women in these spaces, because we did a different study which showed that the men, when they go to these public participation, the planning and budgeting cycles, they request for, big infrastructure, big buildings, roads. They just want to see things. And then when the women were asked, the women were like, can we equip a hospital? Can we have nurses? Can we have drugs? But that is not something that is being given a priority because the women are not there. So I guess we'll move to a Q&A session. We have, you can ask questions to the panelists, maybe 3 questions. I understand we don't have much time. So like 3 really burning questions that you want to get responses from our panelists, both the ones that are here physically and the ones that have joined online. So there's a hand here. If we can get the mic here, please.
The importance of let me say. I thought maybe the importance of it to me would be valuing women's work. How much would it cost to compensate a woman for what she does? And I'm thinking of if that work is valued and a woman decides out of her own volition that she's going to be a stay-home mom, then you'd actually find that actually that can change the gender norms, that men can also say, yes, I'm also going to be a stay-home dad because I'm going to be compensated for that. So I'm actually seeking an opinion on that. And secondly, I'm also thinking that when we value that, it would also mean that when maybe a marriage is dissolved, a woman in the village, let's stop thinking about the elite woman. A woman in the village who is told by her husband, I don't want to see you. You're not the type of woman I wanted. And most times she just goes with the paper bag that she can move. But she has spent all her life contributing to the matrimonial property or looking after those children and looking after this man to bring in whatever he brings home. So don't you think that is very, very important, that valuing this woman's work would contribute to that woman being compensated when a marriage is dissolved? And secondly, this is more like a comment or a contribution. When we put the proper infrastructure, for example, we have piped water at home, we improve the gadgets that we work with at home, then it would also make men also participate, because it has been found in developed countries that when we make it easy at the household level to do care work, men actually contribute. And you find that a man is very, very comfortable looking after a child and bringing up, even cooking, deciding that today I'm going to be the one to cook, because it is easy. They're not going to fetch water from the river. And I think it is very, very important that there is a comprehensive policy on care work, and most of it is valuing this work that a woman does, and at the same time changing the gender norms. Thank you.
Thank you so much. Do we have Miss Carol online? She left, I guess, right? Carol Gaturi, are you there? Okay, so I guess she's not there, but from what I understand, what the Time Use Survey is trying to do is to actually quantify unpaid care and domestic work, and in terms of monetary value, what that 11 hours would translate of unpaid care and domestic work would translate in terms of, in monetary terms. I guess this is now the question you're asking, and this would probably take us to that step where when you're telling a woman that, okay, we are divorcing, they can actually calculate and say this is what you should be compensated for just being in the house and taking care of the family and taking care of you as you go to work, you know. This would make men be more interested, because now they see a monetary value to it, then they would want to also engage. And on your last comment where you said investment in infrastructure can lead men to participate, you know, or to take part in, you know, helping around the house, cleaning. It's actually something that came out when we did the household survey in the informal settlements, that the men said they're willing to wash clothes for as long as they're doing it in the house, you know, because there's water in the house. They can do the washing inside, and then the woman can go and hang those clothes, because they don't want to be seen by other people hanging clothes, because people laugh at them. So they're willing to help for as long as it's done in a way that doesn't expose them to ridicule and mockery from, you know, from the society, which is something I think Ted alluded to, that people are judging him for wanting to take that step to raise, you know, the daughter. So I totally agree with you, and I think it's what some of the recommendations that Ruth gave as far as the policy brief is concerned, that the government needs to start investing resources in some of these sectors, the sectors that women have identified: health, you know, water, and even just having good housing sometimes. When you have a space where you can cook, I mean, compare a man, cooking with firewood and cooking with, if gas was affordable for everyone, I bet more men would want to support. But imagine a man lighting firewood and cooking for the family. It's very few men who can do that. So I guess making this whole investing in, you know, different equipment that can remove the burden, or, you know, the heaviness of that task, can also encourage men to participate, and even boys can support their families. Do we have another question? Is okay, she raised her hand first, and then we'll come to you, and then you.
Thank you so much. Thank you for the opportunity. My name is Yvonne. I actually have a comment, more so, not a question. My comment is this. I think at the beginning of the discussion, for me, basically, it looked like we were moving towards a single narrative, that it wasn't really a choice for women to participate in unpaid care work. So I think we need to be very cognizant that we are not moving towards a single narrative, that it is okay for a woman to choose to sit at home and actually work. But then again, as she put it rightly, we need to see how we can actually quantitate and value that in terms of monetary. The other thing that I wanted to also put forward, because I'm also in the media space, so I'm very cognizant of nuanced narrative. Ted Josiah spoke very well. He's a man I really, really admire. But sometimes as a society, and even when we tend to have such discussions, we almost put it in light that we want to load men that are actually taking care of their own children. So with the way that we frame it, the way that we look at him, the way that we give him a platform to speak, it's almost like, oh my God, you're doing such brilliant work. Congratulations. But we forget that women do this kind of work every single day, and no one gives them any opportunity to be lauded for that work. So I think even in the way that we frame, even in the way that we showcase the perceptions, it needs to be very careful. Otherwise, we'll actually retrogress into some of the societal norms. Thank you very much.
Thank you so much, Yvonne. As she takes the mic to her, and I totally agree with you. I guess every day is a learning experience for us. This is something that hasn't been, is a conversation that we haven't had for ages. It's a new thing, and every day we are learning of how we can phrase this narrative. Because I guess in the way we present things, it's also very possible that we are also propagating this very retrogressive narrative that, you know, unpaid care and domestic work is something that people shouldn't be doing, you know. It should be valued. People should have the option of choosing and saying, you know what, I want to be a housewife, and still feel like they're doing something that is valuable to the, you know, to the economy, and not feeling like, no, because I'm a housewife or because I'm a mother and not working or engaging in other work outside of, you know, what I'm doing in the house, then this is not work. So I totally agree with you with how we nuance it and, you know, the narrative we propagate out there. Your second comment on Ted Josiah, It is true, and I think that is why Ruth also did mention that we are trying to bring also women to the forefront for them to tell their stories and not us to keep talking about women, what women are doing. And it's not just for us to applaud him for what he's doing, or, you know, kind of paint him as a single case, because there are other single fathers out there, but many of them are not even willing to come out and say, you know what, I'm raising my children by myself, because they're judged. That in itself, they just hide behind, you know, other people, and my children are being raised by my family, but they will not tell you, know, straight up, I'm raising my kids by myself, because of that judgment. So at least he's brave enough, you know, to share his story. And I guess the whole idea is to try and normalize this, for people to see that if a father decides they want to bring up their children by themselves, it's still okay. You know, they shouldn't be judged, they shouldn't be discriminated against. People shouldn't look at them like, oh, you're from a different world. It should be a normal thing for every parent, because everyone has a right to bring up their children, right? Over to you.
Thank you very much. My name is Faith, and I'm a journalist as well. I'd like to follow up on the conversation that the first speaker, the first lady who commented on, aliongea juu ya mwanamke kwa rural area, akitoka kwa nyumba yake, enda na paper bag peke yake, because anaambiwa ulileta nini hapa kwa hii boma, and yet she has been cleaning the children, breastfeeding the children, cooking for the man, and so on and so forth. But I think what I want to say is that there is hope, because very recently kumekuwa na kesi, a similar case, a divorce case of a couple. Njeri is here. Of a couple, and mwanamke alileta hiyo case mbele ya koti. Akasema, yes, I was a housewife, lakini nilikuwa na contribute. Ile usafi nilifanya, kuchunga watoto, kuchunga mzee, ni contribution. Na once kesi kama hiyo imekuwa moja, itakuwa na ripple effect. Wengine wataanza kuona na kurecognize. And I'm sure there was a monetary value ilikuwa attached to ile kazi mwanamke amefanya. And the other thing is about the reality in language. And in relation to the Ted Josiah story. Kuna siku niliandika story nikauliza, kwa nini mwanamume akichunga mtoto wake anasema I am babysitting? Kwani mtoto ni wa nani? Unajua una babysit mtoto mwenye sio wako. Kama ni wewe unachunga mtoto, wewe ni mzazi. You know? So it is just about to normalize your conversation about ukichunga mtoto kama mwanaume, that is normal. That is uzazi, sio babysitting. Unajua? Na sio favor pia. And then the other thing, someone talked about social cultural norms when we are bringing up our children. Ukiuliza mtoto ambaye anaenda shule saizi, hata na CBC yetu, if that child has a mother mwenye haendangi kazini, umuulize mama anafanya kazi gani? Hakuna. Na iko tu sawa, like that is normal. Seti mtoto anataka kukukosea. But do you know that's an opportunity to teach that child? That's a teaching moment that we have missed so many times. Unaambia mtoto, mama yako si ati hakuna kitu anafanya. It's like there is no contribution that she makes. Those are very, very teachable moments. Yeah, that's it from me.
Allow me to comment. Thank you very much to the panelists for the very insightful conversations. Mine is really a comment, and perhaps it will touch on this and the other panel. I'm Caroline, I work with Mzalendo Trust, and as you're aware, our work is more on the policy, legislative issue, and public participation. And I wanted to introduce an angle, especially because of what has come up around the infrastructure that is necessary. And I wanted to say that even as we have this broad conversation, it's important to also factor in the element of political participation. Because as you know, when budgets, whether at county level, at ward level, when they are being made, a lot of times women are not in the meeting rooms. As we heard, sometimes the meetings are happening very early, or they're not involved, or they're in the room, but they can't speak because men are in the space. And so we find that even when these decisions and budgets are being allocated for infrastructure, whether it's the health facilities, whether it's the ECDs, women's voices are not heard. And so in most cases, their interests will not be factored in. When you look at it even at the higher levels of political participation, again, you find that the systems, whether it's the cost, whether it's the culture, work against women. And so you find that this one becomes a vicious cycle where women are not sitting at the important decision-making tables where they can make the policy, they can approve budgets, whether it's members of parliament at the National Assembly who should be approving budgets, but because they are so few, their voices may not be heard, or they are not in the relevant committees, or whether it's the MCAs and the CECs at the county level. So as we have these conversations, it's also important for us to align it also to the broader macro issues of women's participation in the political spaces and the barriers that still keep them away, because perhaps if we have more women sitting at the table, then some of these things will cascade down. And also to then, as somebody said, have the women on the table or at the table, but the question is, are these tables accessible? Are we having tables that come in all shapes and sizes that can fit the different interests of women? And so for me, it was just to bring that element of not just political participation, but also public participation at county, at the lowest levels where these decisions, especially from county governments, need to be made, and the decisions that are made there are so proximate to the needs of the women, whether it's a borehole you're talking about and the other infrastructure that I've spoken about. Thank you.
Thank you so much, Caroline. And we are out of time. I do understand that, so we will need, if we continue like this, we'll probably eat into the time of the next session. And I don't know if Ted is still, I can give you a minute, Ted, to just say something, and then we wrap this up. Are you still there? No? Okay. So we do not have time for parting shots, unfortunately, but from what I have gathered, this is a conversation that is just starting. We'll have many more of these spaces to talk about this and probably deliberate more into it on what we need to be doing. But just in summary, we hear it's very important that we need to invest in infrastructure that has a direct correlation with unpaid care and domestic work. We've heard that we can't do this, in silos. We need to come together because we do not even have enough resources to address this as individual institutions. Everyone has a role to play, and that is why we need to come together and start addressing this. We've heard how women need to be in those decision-making spaces. Being in a decision-making space doesn't mean that you have to sit in a boardroom somewhere, in the offices to discuss what money is allocated to what. It starts right at the grassroots level when they're having these public participation forums where women can, petition and say, this is what we need, this is our priority. So I guess for us, the role is to be able to mobilize these women, provide them with the information they need for them to be able to participate meaningfully. We've heard from Irene how this is even now leading to, gender-based violence. So girls now are transacting or exchanging sex to be able to access water. It's a big deal because we keep on saying that water is life. So if it's life, so are these girls going to die because they can't access water, or is it okay for them to just, give sex to be able to access the water? So it's something that we need to start addressing, and the recognition, the redistribution, the representation, and reduction is not only at the policy level. It starts right from our households. Like if you go home today, just ask yourself, what is it that you can do to try, to start acting on this? If you're a man, is this the space where you start, helping out and just trying to start to understand how this is impacting on the women that are in your life? It could be your wife, it could be your mother, your sister, your daughter. Start having those conversations. We'll keep learning. We'll keep talking about it until we get to a point where now everyone is on board and people start valuing unpaid care and domestic work. So thank you so much. And my name is Blandina Bobson, Director of Programs, Oxfam in Kenya, and I've really enjoyed this conversation. I do hope we'll get another chance to meet again, and have in-depth discussions about this. Thank you so much. And to our panelists, thank you so much for the time and for your contributions. I know you didn't get a chance to give your parting shots, but I also do acknowledge that it was integrated within the conversations. Those people who listened, you heard what they were calling for. so they don't have to repeat it for us to be able to act on it. Thank you.
Let's give them a round of applause, please. Yeah, thank you to our second panel. And as Blandina said, this is not a conversation we can have in an hour or 2 hours. So I encourage you to keep talking at lunch, talk with these. The reason why we're bringing everyone together is because we're all in the same, we're trying to solve the same problems.